Okay, your time starts now, doctor.
Hello, good evening. This is Dr. Saeed. I am Senior House Officer in Brain Department. Can I confirm you are Mrs. Sarah, the daughter of Mr. Jack, 65 years old, and you are next of kin?
Yes, doctor, you're right.
Okay, Mrs. Sarah, nice to meet you. We are here today to discuss an issue related to your father's health status. Is that all right with you?
Yes, doctor, please.
Okay, Mrs. Sarah, before we proceed further, how much you know about your father's health status?
Thank you, doctor, for asking. Actually, my father is very, energetic, but all of a sudden he developed some high body temperature a couple of days before, and then he started, talking in a not good way. So we were very worried about that, and we bring him to hospital. And the hospital doctor, emergency department, we were there. So he admitted 2 days before. So they have done some scans, and they were asking to take some water from the back of his, you know. So I'm here to discuss what's going on with him and how he is now at the moment.
Yes, Mrs. Sarah, I appreciate your knowledge about your father's health status. Did you have any expectation about the meeting today?
Really, doctor, I don't know, but I want to be that I want to listen from you that my father is safe and he is, not suffering some sinister diseases.
Okay, I appreciate that. Okay, Mrs. Sarah, as I understand from you that your father has come to us. He has body temperature for 2 days and abnormal behavior. We do for him brain image and even we take some fluid from his bag. And actually, the result is here with me and not as we hope.
What do you mean, doctor? What do you not hope? Is there something very serious?
I appreciate your concern, Mrs. Tara. Yes, it revealed that your father has a condition called meningococcal meningitis. Don't bother by the name. Did you hear about it before?
No, doctor. What is this? Is this something very
Okay.
serious?
Appreciate your worries. Please, Mrs. Tara, let me to explain to you this meningococcal infection. Meningococcal meningitis is a medical term for medical condition in which it is a bug infection that affected the brain and the covering layer of the brain and the main cable of the back that was containing the nerve, leading to the symptom which your father have as high body temperature and abnormal behavior. And actually, Mrs. Tara, I want to tell you this is a serious condition as it can be complicated by spreading for other organ or even in the blood. This infection it will cause.
Wait, doctor. Really, I don't. This is too much information. All of a sudden, you are giving, and you some give some bad news, and all of a sudden, this too much information. Can you explain me in a better way because I don't understand what's going on in the brain actually?
Yes, Mrs. Tara, I appreciate your worries about this, and I will explain to you in the more uh, simple ways. I will draw for you here.
Yes, doctor.
This,
That's better, I think.
yeah, I will draw this the brain, and there is the main cable of the back that contain nerves and everything, and there is covering
You
layer
you
here.
can draw, doctor. I am going to start this timer. You can draw now. Okay, if you want to draw.
Okay, mm. My drawing is
Yes.
not good, but it is okay. What is the pen?
Pen on the left
Yes,
side. You see.
it is loading, preparing your whiteboard experience. Yes.
Can you?
Yes, I found the pen. Yes.
O-
Okay,
Okay.
Mrs. Sarah, this is your brain. Okay, and this
Okay.
is the main cable of the brain. This, okay. There is
Okay.
covering layer here, Mrs. Sarah. Covering layer in the that cover the brain and the main cable. And there is bug
Okay.
infection. Yes, here
Okay.
there is bug infection affected all this. Yes, and this
Okay.
lead in this condition according to the area was supplied according to the area of
Okay.
the infection, this infection it will cause a symptom like which your father have. These affect yes his body by this decreasing level of awareness and even high blood, high temperature and even neck stiffness. I mean by neck stiffness, this difficulty moving his neck and every symptom that related to this disease, and it is serious, by the way, Mrs. Tara. I'm sorry for telling you that, but be sure, Mrs. Tara, we are not we are going to treat your father well to give him proper care. Now, Mrs. Tara, I would like to tell you that our plan of care for your father is to admit him in our care. So at least to put him in the side room. Don't afraid about that. This side room, because this infection, it is contagious. I mean by that, it can spread to other people. So that we will involve him in a separate room, and to give him to involve our brain doctor, our specialized staff nurse, our this bug infection doctor, to give him the full plan of care, to give him suitable antibiotics. Are you following me, Mrs. Sarah?
Yes, doctor, I'm following you, but it's more concerning for me. Why you are going to give a separate room to him? It means
Yes, I
my
understand.
father is having very serious condition.
I understand your condition. Yes, actually, Mrs. Sarah, we need to put him in a separate room, so that to prevent the spread of the infection to other, and even also to control the his disease.
Okay.
Okay. Apart from that, Mrs. Sarah, we need to notify this disease as it is notify this disease for preventive medicine department, and also we need to I mean to bring all the people who was close contact with him in the previous days, to give him a plan of care, suitable management. I mean, they will give him them treatment. Is that all right with you?
Yes, doctor, do whatever you can for him because we love too much our father, and I cannot see him in this condition. And when you
Yes.
will when you will put him in a separate room, will someone will be with him?
Yes. There is. You mean from your side, from your family, or from our staff?
Okay,
From
that's
your
great.
side, family. If you want to go to see your father, you can allow by some precaution. I mean by that, you need to wear mask, you need to wear gloves, and even gown. And if the specialized nurse will teach you about all of this. Is that all right?
Yes, doctor, but is it a curable condition?
I appreciate your concern. Yes, Mrs. Sarah, it is curable if we start treatment in the suitable time. Yes, it is treatable.
And what can happen if treatment not going well or something is missing?
Yeah, yes, there is some bad effect, or I mean that complication. It can raise, such as it can. Some people have weakness. This weakness can be permanent. Some people have hearing loss, and according to the condition, response of the condition to medicine. If you have another concern.
Yes, doctor, if we follow all these precautions which you have mentioned, really I'm very thankful to you. So after how many days he will get recover and he will be able to go with to home to with me?
Yes, Mr. Sarah, this to be he will be under assessment of our consultant and our daily team. They will assess him until he will be okay. Then they will decide to shift him to the ward, maybe at least this according to their assessment, and they will shift him for the ward. Then after that, as treated as in outpatient clinic, and to be under follow up. After that, they will can be discharged.
Okay, 2 minutes left.
Okay. Kama is you have another concern, Mrs. Sarah?
Are you going to give some medicine now?
Yes, we will give him medicine that to kill this bug infection.
Okay, okay.
Okay. Can I ask you some social question?
Yes, doctor, please. Okay.
Okay. With whom your father living?
Yes, doctor, he's living with us and myself, my wife, and 3 children.
Anyone depend on him? Anyone needs support from our side?
No, doctor, he is retired and he's having handsome, backup plans.
Okay. In any history of smoking? Did your father smoke?
No, no, doctor, he is not smoker.
Okay. 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 I would like to summarize to you that your father come for us here by this body temperature, raised body temperature, and abnormal behavior. We do for him imaging and worked up. As a result, relieve that he has meningococcal meningitis. I explained to you this is a bug infection and it is contagious. I mean by that it's spread for other organs. That is why we need to admit him to a side room, separate room, and to give him proper, to start him suitable antibiotic to kill this infection, and to notify this disease and to contact tracing. I mean by that, we will call every people close contact to him in the previous period to give them medicine. And also, Mrs. Sarah, I will give you website and brochure to read more about this meningococcal meningitis. Did you have any question for me?
No, doctor. Thank you so much. If you have any question, I will contact with you. Thank you so much for your today's time.
Thank you, doctor.
Thank you. Time up.
Thank you.
Dr. Sayed, very well done. You were so confident, and you have done a lot great job. You touch almost every aspect of this scenario, which was very important. Uh, and there are few things actually I want to add in your performance.
Yes.
Introduction was very nice when you get inside that. Of course, first of all, let me tell me one thing. In which category you will fit this scenario?
This bringing bad news
Breaking bad news of what? And
of disease, contagious disease, infectious disease,
and
I mean.
and communicable disease,
Communication.
right?
Yes, communication. Yes, yes.
Communicable disease, okay, which
Yes,
can spread.
yes.
So you need isolation in this case. Whenever you see this scenario in any exam, you read the scenario. This is a breaking bad news plus communicable disease. Keep four words in your mind. Your task is those four words after explanation the disease. That is rinse. RINS. Rinse. R for reassurance. I for
Yes.
isolation. N for notification. S for screening of close contacts. So you have done your job almost. You touch each and everything there. Introduction, I don't know what the format, but I think there is no need to mention any time. Good evening, good morning. I think no need to use these words, especially when you are going to the PACES exam. Just say, hi, my name is Dr. Sayed. I'm one of the doctor here. Okay. So
Okay.
am I talking with Miss Sarah? You did very well. Your introduction was very impressive. And, very confident you were there. Dr. Nana, 1 minute, I will explain later. Okay. Then introduction and what I do actually, Dr. Sayed, I'm basically, categorizing all the communication into three parts: part A, B, and C. Part A and part C is driven by a doctor, candidate, and part B is driven always by a surrogate. Introduction in our hands, closing in our hands. These are the two parts. Part A is introduction, part C is a closing. So we are the drivers of those parts. Part B is always dependent on the surrogate, how he will behave and what you are going to do. You are fulfilling your task. He will remain cool and calm. He will give you less concerns. If you are missing something, the blessing of these surrogates is that so they are pushing towards your task always. They are trying to help you in exams. So part B, whenever you are going to explain the breaking bad news, as you have done very well, we have received the labs and the scan reports. So I don't have a good news for you today. The results are not like that we hoped. And take a pause, golden silence, and then this shows that your father condition. This test shows that you have a condition. Your father's condition is known as meningococcal meningitis. Pause. Have you ever heard about that? No, doctor. Do you want me to explain to you? Yes, doctor. Let me draw for you for the better understanding. Immediate action. You did very well. So this is the brain. These are the layers of covering our layers of the brain, and these are some bug infection. They got access in the blood or some by any means, so they are causing hair soreness. And whenever you are going to describe the symptoms, don't go in details. They can cause the symptoms. They can cause the problems. Why? Symptom is a jargon actually. They can cause a problem similar to your father. Halas. No need to explain details. Don't waste your time here. Because his father is having headache, fever, alter sensorium. So the surrogate will understand you have any headache. It is a curable condition when it is treated in time. But it can be dangerous or life threatening if left untreated. So you are going to give him complication and a red alert. It's very important to stay in the hospital. It's very important to isolate him. It's very important to give the antibiotics. So we use here the mnemonic escape. Whenever you're going to explain any condition, any disease, you need to do escape. ESCAP, escape. E for etiology, S for symptoms and signs, C for complications, A for action, what we are going to do next, and P for plan, plan of management, immediate plan of management, and a future plan of management. Okay, you did very well. You escaped very well from the part category B, which was dependent on the surrogate. So we need to escape from the surrogate, any part B. So come to the closing. Do you have any concern? You did very well, awesome. I think you have answered all my questions. But one thing, Dr. Said, your speed was a little bit, you know, more, but understandable. Take with you always surrogate. Check understanding after close, after giving information, one line, two lines, take a pause, just ask, are you getting me? Are you with me? That makes sense to you. These three, 4 words, you know, always you can use in long clinical consultation when the patient, the surrogate is asking, and especially in the communication, very helpful. Are you getting me? Are you with me? That makes sense to you. Am I understandable to you? And one thing went wrong in your whole scenario, Dr. Sayed. Summary. You will never summarize in communication by yourself. You are a giver, and who is taking the information? Surrogate. So surrogate should, you know, summarize this case. How much he got from your consultation? He gave you an idea, not you. You
Okay.
get the point?
Yes.
Are you getting me, Dr. Sayed?
Yes, yes, doctor. I'm going to you. Thank you, doctor.
Yes.
In
So
communication, I will not summarize myself. Yes.
the first of all, there is no need of summary. Just utilize this time by safety netting. I'm using this, wording safety netting when you are giving the brochures, leaflet, and the telephone number and hospital number and the YouTube videos link. This is called a safety netting. You are going to keep him safe. He will understand. He will learn about the condition. So if you develop any new symptom, any new thing, just let us know, and we are here to help you and support you. Okay, this is a safety
Okay.
netting in the closing.
Okay.
Otherwise, that was awesome. You're all you have touched each every skill C, F, and skill E was good, and welfare was very nice. A little bit, this closing, especially summary and draw. You go came to draw a little bit late after probing by the surrogate. Otherwise,
Mhm.
it was very good performance from your side.
Thank you, Dr. Athar. I am a little bit fast because I am Irish examiner, Irish candidate examiner. That is why we have
Ah,
only 15 minutes. That's why we used to be fast.